Hey guys, Chris here today, and I want to talk to you a little bit about vitamin D. Now, it's getting a lot more media exposure, and I think there's some confusion out there about what it is, the importance of it, what are some signs of a vitamin D deficiency, and so on and so forth. So I wanted to touch on that today, real quick. And the first thing is, what is vitamin D? Well, vitamin D is actually a vitamin that our bodies can create through sun exposure, supplementation, and nutrition. Some of the benefits of vitamin D include bone health. It helps with calcium absorption and processing. It has anti-cancer properties, and it also helps with just overall immune function. So how do you know if you're deficient in vitamin D? That's a great question, and the list is actually pretty extensive. It can be things from bone pain, muscle weakness, autoimmune disease, cardiovascular disease, obesity, multiple sclerosis, depression, diabetes, asthma, so on and so forth. So as you can see, it's pretty extensive what can be an indicator of a deficiency. And believe it or not, a large part of the population is deficient in vitamin D. Actually, a study was done back in 2009. They took about 19,000 people throughout the US and tested their vitamin D levels. And what they found actually was that about 75% of them were suboptimal. And so that's a huge percentage of that, right? So there's many reasons for that. There's a big scare with the sun exposure. There's a big scare with skin cancer. People aren't eating as healthy as they used to. There's a lot of factors, but ultimately, if we're low, we need to get those levels up, right? So how do you know if you're low? Well, it's really easy. You go to your doctor and you ask for the test. It's a simple blood work panel that they can do. They can tell you right away where your level is, and you can then start down the road to getting those levels back up where they should be. And the way you do that is basically there's three options. There's the sun exposure itself. So to take that route, what you need to do is, just like the name indicates, you get outside in the sun. And the thing to remember with that is, has to be bare skin. You will not absorb, convert, create vitamin D if you have sunblocks or sunscreen on, or if you have clothing on, or if you're behind a window, whether it's an office or your car window. None of that will facilitate vitamin D production. So it has to be bare skin. How long, depending on who you ask, for your body to produce that because of the other supplementation. When you go to your doctors, if they tell you that you are low, they may prescribe a mega dose of vitamin D for you. You can also get vitamin D supplements online. I'll put a link down below to one that I recommend, just because it also includes vitamin K2, which helps with the processing of that supplement and getting those levels to where they need to be in your body. Keep in mind though, vitamin D takes some time to build back up in your system. It is not one of those supplements where you take it and feel it immediately. It does take some time. It's almost like probiotic in that sense. It takes some time to get those levels to rise back up. And the third way to get it is through your nutrition. Now, nutrition's going to be tough. It's more, I hate to say it, but nutrition's more of a supplement than the other two, because the foods that you get it in are going to be fairly low dosage. So foods you can get vitamin D from are salmon and other fatty fishes like mackerel, tuna, trout, that sort of thing. You can get them from egg yolks. And you can also get it from cod liver oil, and that is actually going to give you the highest bang for your buck. The cod liver oil, you may not like the taste. I think they are adding flavors to it nowadays, but by far that's going to give you your highest concentration from a food source, is that cod liver oil. But again, you can supplement with it. You can get out in the sun a little bit, but I really highly encourage you to go talk to your doctor, get those levels tested, see where you're at. And there's a fairly good chance you might be low. So it's better to know and work on that and get those levels up so that you can experience optimal health for yourself and go from there.